Have you ever wondered why the World Health Organization has declared the recent Mpox outbreak an emergency of international concern? Mpox, once known as monkeypox, is a self-limiting viral infection caused by the Mpox virus. Symptoms often resemble those of the flu, with fever, headache, muscle aches, back pain, and fatigue. However, one distinct symptom is the development of pox-like rashes that last for 2 to 3 weeks. While it's self-limiting, it can be fatal, especially for children and those with weaker immune systems. The disease has been around since the 1970s, primarily affecting people in certain regions of Africa. Yet, since 2022, the disease has taken a new turn, causing over 99,000 cases and more than 200 deaths across 116 countries. The primary mode of transmission is now predominantly through sexual contact. But what is this disease and why is it causing such a worldwide concern? Mpox, previously known as monkeypox, is a viral infection with symptoms that can last up to 3 weeks. The most common symptoms include fever, headache, muscle aches, back pain, and low energy, along with distinctive pox-like rashes. This disease can be especially dangerous for children and those with weakened immune systems. First reported in humans back in 1970, Mpox primarily affected people in endemic regions in Africa until the global outbreak in 2022. The current concern revolves around the spread of a particular strain of the virus known as clade Ib, which is predominantly transmitted through sexual contact. This is a significant development as sexual transmission of this strain had not been reported until recently. In the grand scheme of things, there are 2 different clades of Mpox, clade 1 and clade 2, with clade Y being more deadly. The spread of this new sexually transmissible strain is what has made this a global emergency. With the first case of the more contagious clade Ib Mpox infection reported outside Africa, the risk of a global outbreak is real. Our interconnected world, with its intricate web of international travel, can potentially spread the disease far beyond its current locations. However, the fight against Mpox is actively ongoing. The World Health Organization, along with other international bodies, is spearheading efforts to develop and distribute vaccines. 2 vaccines are currently in use, recommended by WHO's Strategic Advisory Group of Experts on Immunization. Recently, an emergency use listing for Mpox vaccines was triggered by the WHO to expedite vaccine access for lower-income countries. This decisive action also encourages organizations like Gavi and UNICEF to procure vaccines for distribution. The WHO is coordinating with countries and vaccine manufacturers on potential vaccine donations, aiming for equitable access to vaccines, therapeutics, and diagnostics. It's crucial for everyone to stay informed and take necessary precautions. We must all do our part to prevent the spread of this disease.